Good afternoon, everyone, and welcome to Lunch and Learn, where we discuss topics related to the pelvic floor through brief summaries that can be enjoyed on your lunch break. You can multitask by letting your brain and your stomach digest at the same time. So last week we discussed the micturition reflex and the general description of how we actually urinate. This week I want to discuss a common habit for many people that can be contributing to pelvic floor dysfunction and ultimately lead to urinary symptoms, including urinary frequency and urinary urgency. So scenario, you're getting ready to leave the house for a few hours. Oh, let me go to the bathroom real quick before we leave, just in case. You're getting ready for bed. Let me go pee real quick, just in case. We're about to start a movie. Time to run to the bathroom, just in case. Peeing just in case, or as we like to call jicking, just in case, J-I-C, can create confusing signals in the brain-bladder reflex system. Remember last week we discussed how there are specialized stretch receptors in the bladder that measure how full the bladder is, and when it crosses a certain threshold, it sends a signal to the brain to start the process of contracting the bladder and relaxing the pelvic floor so that we can urinate. Well, when we force ourselves to go to the bathroom before our bladder is actually full, in addition to potentially pushing or straining the urine out, also a problem to be discussed at a later date, it can begin to change the sensitivity of those stretch receptors, making our body and brain think that we need to go to the bathroom more frequently than we actually do. Let's take a look at a little visual aid here, and be kind because remember I am a physical therapist, not an artist. So here we have our little bladder and brain. So here, this is what we typically would see in a normal functioning system, which is that this is the bladder continuing to fill. Here's our little dotted line threshold here. So once the bladder reaches this threshold, the stretch receptors here have been stretched enough that it's crossed the threshold and it's sending that signal to the brain to say, we're full. Brain again sends the signal back down to let the bladder know to contract and the pelvic floor to relax in order to fully empty the bladder. So that's what we want to happen. Now, when we're doing things like peeing just in case, we're starting to disrupt that system a little bit and we're not letting it function properly and how it wants to function just on its own. So here we have an example of what it looks like when we're going to the bathroom just in case. So here we have this new threshold, which is this blue dotted line here. We see that the urine has filled up to this line and we're like, oh, I'm getting ready to leave the house for a few hours, so let me go to the bathroom. Well, so we're kind of skipping this part here because the stretch receptors weren't involved. So the brain tells the bladder to contract and the pelvic floor to relax. And then you go to the bathroom. But these stretch receptors are like, what? We were left out of this. What happened? So they can become more sensitive. And so what happens is this threshold will start to lower so that the stretch receptors can still be involved in order to jumpstart this process, okay? So what can happen is the more we do things like peeing just in case, it can start to increase that frequent urination because now those stretch receptors have become more sensitive. So instead of the threshold being all the way up here when the bladder is actually full and ready to go to the bathroom, it's moved down, so less stretch is happening. It's only about halfway full, maybe even less sometimes, and it's sending that signal to the brain to jumpstart that process of needing to go to the bathroom. So that's why we can start to, instead of what we typically want, which is every 2 to 4 hours, depending on levels of hydration, we can be going to the bathroom every hour, every 45 minutes, which is very, as most people would agree, that's not very functional or convenient. So we can see how going to the bathroom just in case or before we actually are getting those signals can contribute to and exacerbate urinary symptoms and pelvic floor dysfunction. Now, there is good news. Our bodies are super smart and adaptable, and this is a system that we can retrain. If you're currently experiencing symptoms of urinary urgency or frequency, I would recommend seeing a pelvic floor physical therapist for an evaluation and a game plan to address those symptoms. But for now, if you're going to the bathroom more frequently than every 2 to 4 hours, or if you find yourself wanting to run to the bathroom before you leave the house or before going to bed, because that's just this habit that you've developed, try this instead. Stop. Take a few deep breaths, really tuning into your body, really engaging that pelvic floor to let it relax as you're inhaling, and just kind of doing that intentional check-in. Do you actually need to go to the bathroom, or are you going just in case? If it is the latter, skip the potty break and give your body and your bladder that opportunity to fill and go as when you're ready to go, and let your body do that signal in that loop in order to go to the bathroom when it's ready. The other thing I want to say is that if you are doing this, it's okay. You're not necessarily causing any damage right now. I think the biggest thing is awareness, and then starting to be mindful of those habits that we might be developing. In my time working with people with pelvic floor dysfunction, what I often find is it's a scenario of straw that broke the camel's back. So there were usually a handful of things going on that ultimately led to the exacerbation of symptoms and the experience of, that discomfort, pain, urinary incontinence, constipation, all the symptoms we tend to see. And so we just don't want to be contributing to a system that might ultimately have that straw that broke the camel's back moment. So by taking these steps to be more mindful of how we're kind of treating our body and our bladder can help prevent us from having problems in the future. Remember, friends, that knowledge is power, and if you understand how something is supposed to work, you can be that first line of defense to know when something is off and to advocate for your health and wellness when there is a problem. Thank you for joining me today, and tune in next week as we discuss different types of incontinence. So remember to subscribe to my channel, follow me on Instagram and Facebook. That way you can keep up with more information about the pelvic floor. Have a great day.